Today we'll be discussing the Iowa Medicaid long-term transition to the Iowa Health Link for managed care. We'll be discussing the following topics today: an overview of the transition, its related timeline, safe harbor, how that applies to providers. We'll also discuss the impact of nursing facilities, case management, as well as other programs under the waiver and long-term care services, and how to determine Medicaid eligibility for these members. In February 2015, DHS released the Request for Proposals, or RFP, titled Iowa High Quality Healthcare Initiative, more commonly known as Medicaid Modernization. Medicaid Modernization will become effective pending CMS approval on March 1st, 2016. DHS is contracted with the three bidders listed on this slide: AmeriGroup Iowa, AmeriHealth Caritas, and United Healthcare Plan of the River Valley. The goals of this program are to improve the overall access and quality of care for our members. We will assure this through additional access to care, significant oversight, as well as a more predictable budget for DHS. Moving forward, Iowa Health Link will be the brand name for Iowa Managed Care, as this program does link behavioral, physical, and long-term care services together into one program. When you hear Iowa Health Link, think managed care. Here you have a visual of the program overview. You have DHS as the umbrella covering all the services with Iowa Medicaid Enterprise. And Iowa Medicaid Enterprise is comprised of three components: the Iowa Health Link for managed care, Hawkeye, which will also be administered through the three MCOs, and Iowa Medicaid Fee-for-Service for those individuals who are excluded from managed care. One very important component of Iowa Health Link is the new long-term care ombudsman. Ombudsmen operate independently of DHS and advocate on behalf of the members to help educate them on the Medicaid policies and procedures, as well as related needs for services. There will be 2 additional staff added for long-term care ombudsman office within the existing program. It is important to note the populations impacted by this transition. The majority of Iowa Medicaid and Hawkeye members will transition to Iowa Health Link. The excluded populations are listed on the right-hand side of this slide, which would be the individuals participating in PACE, the American Indians or Alaska Natives, who can choose to opt in if they are so inclined, anybody with retroactive eligibility, presumptive eligibility, and limited emergent services. Next, we'll discuss the transition and its impact to our providers. It's important to note that there is a 2-year transition period for the Iowa Health Link for long-term care and waiver services. What this means is these facility-based services and home and community-based waiver services actually have until February 28th, 2018 to conclude the signed contracts before March 1st, 2018, where the MCO networks are expected to be fully in place. Case management is excluded from the 2-year transition, and they fall into a 6-month transition, which means they must be fully transitioned by August 31st, 2016. There is a safe harbor period extending through the month of March 2016, where providers can expect to continue to receive their full Medicaid reimbursement rates, 100% of the established rate floor, for services rendered in the month of March. Beginning April 1st, providers that are not contracted with the MCOs would receive 90% of the established rate floor. Over the next several slides, we'll discuss the impact of nursing facilities. Beginning March 1st, 2016, all services for MCO-eligible members will transition to the MCOs. However, beginning February 1st, 2016, case activity reports will no longer need to be submitted, as PathTracker Plus and links to payment will be utilized to upload these automatically to DHS. For providers unfamiliar with PathTracker Plus, Ascend, the contractor for PASSAR, is available and conducting training. Web-based trainings are available daily at 9 a.m. and 2 p.m. at passar.com/Iowa default. Any other facilities will still continue to submit their case activity reports. MCO nursing facility reimbursement rates that have been established include the current rebasing amount. Quarterly case mix rates and adjustments will continue for fee-for-service members. The unmet medical needs will be covered by Iowa Medicaid Enterprise as they are now. They will not be changed. Unmet medical needs fall into the category of retroactive eligibility. Next, we'll discuss the impact of the transition to case management. Members may continue to utilize their current case manager until at least August 31st, 2016. During the transition from March 1st to August 31st, if the existing case manager relationship ends, a new case manager will be assigned by the MCO as they are responsible for those services. MCOs will begin to transfer the case management activities beginning September 1st, 2016, with all activities fully transitioned no later than February 28th, 2017. The MCOs are determining how best the case management services will be rendered, whether it's through subcontracts with current case management agencies or whether they'll be conducting these services in-house. The IME is responsible for communicating all existing service plan information to the MCOs. Existing service plans that extend beyond May 31st, 2016 will be administered by the MCOs. IME is determining the best manner in which to extend service plans through this transition. The MCOs must honor all of the non-residential services at the time of the member's enrollment until they have completed a new assessment and the service plan has been updated to reflect the new information. Case management agencies will submit their cost reports to the IME for fiscal year 2016. Cost reports will include all the units and services billed for dates of service through February 29th, 2016, and all claims billed to the Iowa Medicaid Enterprise for non-MCO members through August 31st, 2016. DHS will continue to make all eligibility determinations for members. ISIS will still be utilized by DHS and the Iowa Medicaid Enterprise to determine level of care, track financial reviews, and waitlist management. MCOs will have their own manner in which they track and record service plans. The MCOs are responsible for developing all service plans for the eligible members that they have assigned to them, and will occur after the member has been enrolled with that MCO. Money Follows the Person, which is a grant program for individuals with high-intensity needs being discharged from facilities and transitioning back into the community, will continue. It is still covered by DHS. All medical services will be handled through the MCOs organizations directly. Services covered by Money Follows the Person are only eligible for 365 days following their discharge. Consumer-Directed Attendant Care, or individual CDAC services, will also transition to the MCOs beginning March 1st, 2016. All individual CDAC providers have been automatically enrolled with each of the MCOs to ensure continuity of care for their members. CDAC providers must work with the MCOs to determine their billing policies and procedures, beginning for dates of service March 1st, which means claims submitted in April of 2016 will be sent directly to the MCOs for payment consideration. Next, we'll discuss verifying eligibility for our long-term care and waiver members. The IME has two methods in which long-term care providers can verify eligibility. This can be done through a phone line or through a web portal. Verifying eligibility allows you to confirm their coverage benefits, which managed care organization they are with. If you use the phone line, you can also confirm the check amount that you would receive from the IME for that week. The Eligibility Verification System, or ELVS, is available by phone at the numbers listed on this slide. It is completely free and available to all enrolled providers. You can enter your enrolled MPI number, enter the member ID and or their social security number, and you can confirm eligibility for that data service. It does not display prospective eligibility. It is data service specific for the date you are checking or past dates only. Providers may also register online to view eligibility through the EDI-SS web portal. The first link on this slide will take you directly to the registration page, in which you complete a form and obtain a user ID and set up a password. The link on the bottom of the slide is the link directly to the web portal to check eligibility. Provider services outreach are always available for our providers. We offer on-site training, will always help with escalated claims issues, and are available at that email address listed on the slide. Thank you.